Okay, we'll get started here in just another minute. Okay, we'll get started here in just another minute. Hopefully I have paused that and it's working right now. Okay, good morning. I hope I've got my audio stuff figured out. If I start talking over myself, just bear with me for a second. So we wrapped up chapter 22 last week, which I think is good. This last chunk of material, I always feel kind of rushed to get through here. So I think we were kind of fortunate having the opportunity to start a little bit earlier with that material. So this week we were scheduled for what we covered last week plus this chapter. So hopefully that will get me right on top of things. That's what I'm hoping for. So this unit or this chapter is the urogenital system infections. There are all sorts of potentials when we think about this. There are also some similarities and differences when we start thinking about males and females and their respective potentials for infection, or maybe to exhibit symptoms, or maybe not. It really kind of depends. There are definitely infections as we move through here that both sexes will experience and have symptoms. There are a few that more common in males to not exhibit any sort of symptoms, but they're still infected. So there's a little bit of variance with that, and we will, we'll move through and discuss some of that stuff as well as we progress through this chapter. So a lot of pathogens, not all of them, but a lot of pathogens when we think about the urogenital tract, we're capable of detecting and in turn cultivating, usually through urine specimens. We think, and it's not 100%, but we think, the urine technically sterile, really, when it's up in the kidneys. Yes, as we are voiding urine, oftentimes in a normal individual, it should be relatively free of organisms. However, dependent upon how we have collected the specimen, there is definitely potential for some normal flora to be collected as well. And the text does mention that, a urine specimen that's left out or left for about 24 hours or so, oftentimes you will be able to cultivate some stuff. And it's likely, in those circumstances, normal flora and not the result of bacterial infection. Or other stuff doesn't have to just be bacterial, but we're starting off, that's really what we're thinking is bacteria. So we got a plate here where we've cultivated this, when we think about UTIs, urinary tract infections, when we think about these, oftentimes with a urine specimen like this, we will plate it out and we will use a special loop. Usually These loops are plastic, they're disposable loops, and they are calibrated. You guys have worked with loops in the lab to inoculate bacteria, and they're metal loops. And those loops, as you have looked at them, you will notice that some of them are nice circles, some of them are bent and messed up a little bit, and the amount of substance that you're able to transfer on any of those loops that you grab is going to be different. That's a potential issue when we're thinking about something like this, trying to maybe evaluate and potentially quantify what sorts of stuff is going on. All right. So these loops typically, like I said, disposable plastic loops, and they're calibrated. They're a perfect little circle that's calibrated to deliver a microliter of solution, in this case, a microliter of urine. You know, there's a finite amount of specimen that's been deposited onto the plate. And then as we start looking at stuff, each of these individual little mounds here, we would call a colony, and we could further call it a colony forming unit as the result of a single bacterium that's replicated countless times, all right? So dependent upon how much you've really got going on, if you see a handful of colonies, well, it's probably just normal flora. As we start getting 100+ colonies on a plate, now we start thinking there's definitely some stuff going on. Dependent in this plate, as I looked at this earlier, and then I was trying to skim through the text to find some details, I couldn't find anything that was telling me specifics about this plate. I don't do a lot of stuff with urine in the first place, so the specifics with plates, I'm not 100%. I feel like we may have a little bit of lactose fermentation with some of these pink looking colonies. The other stuff, I'm not exactly sure. Maybe somebody else like Proteus. Proteus is a potential for UTI. So too is our little friend E. coli that would be a lactose fermenter. Like I said, I'm not exactly sure which organisms we're looking at on here. But it looks as if we do have a couple of different ones, the dark and the pink. So again, there are numerous potentials with that and possibilities to identify a lot of different potentials, right? So there's a couple of images here, some anatomy as we move through. I'm not going to expect to commit all of this stuff to memory, but just looking at it just gives you a little bit of an idea as far as where we're talking about. This image are shared features, male and female, having both structures and possibilities as we're thinking about urinary tract infection, the possibility for bacteria to colonize and cause bladder infections, to potentially move up the ureters into the kidneys and cause, I would assume, more serious infection. Not that any sort of UTI isn't bad news, but as we progress up and infect, there's greater possibility for damage. There's other potentials. We mentioned Streptococcus pyogenes and the possibility with some of these immune complexes to impact the kidney. That's not really an actual infection where we've got bacteria causing issues, but it's a similar ill effect in these kidneys as a result of a bacterial infection elsewhere. We're not thinking about that type of kidney damage. We're thinking about a true infection where we get up in there. So a blow up of the kidney, and this, you know, both multiple slides through here should be, if you have already had AMP, hopefully a little review, and if you are yet, you will cover this in definitely some detail. I feel like AMP lab, you do some urinalysis. We'll see some dipsticks here in a second that clue us into some things. The potential for infection is one thing, but there's other stuff that those the urinalysis will allow you to detect as we're thinking health status of the patient. We're focusing on bacteria, all right? So the kidney has several lobes. I said I didn't want you to get bogged down, but I'm going to point a little of this out. Each of these is a specific lobe, and then a blow up of that lobe. As we look at it, there is a tremendous amount of stuff going on inside of each of these lobes. So we see filtration. So blood coming in, filtering, removing wastes, dealing with really osmoregulation as we're dealing with water balance as we're moving through. And you can see urine flowing out as the end product. So blood, the arrows, you can kind of follow the arrows, and there's all sorts of business going on here. Arrows coming in up to the top of this lobe that's lighter colored. This is where we see the glomeruli or glomerulus, single one here. We're just looking at one aspect here. This thing is full of these guys, all right? So numerous glomeruli, arteries going in, the blood moves through, we come down into this bit that's darker colored, as you see right here, and the fluid is moving through all of these arrows. This loop of the nephron, I believe, if I recall, A&P for me was long, long ago. I want to say they call this the loop of Henle. Maybe that's right. Are you shaking your head? Yes? I knew it. I remembered. How? I don't know. Sometimes you remember things like, senseless stuff, right? If I ever went on Jeopardy, would that be a question? I bet not, but I remember it, right? Stuff that is on Jeopardy, I don't know what the heck's going on, right? But loop of Henle, I can tell you all about it. All right, so we move through here, through the loop of Henle, back up, and then ultimately urine is what's flowing through to the renal papilla, ultimately to the ureters, which we see right here, that going down into the bladder, and then out through the urethra. So potentials for organisms to come in and cause issues and potential serious damage is definitely there. And there are numerous things that we think of as potential culprits for causing some of that damage. And we'll progress along and start talking actual disease. So as we look at a comparison of female and male reproductive tracts, there are definitely some potentials with this that set the stage, as I was saying, to see differences as far as maybe recognition of symptoms, or maybe also the ease of potential for infection. So female reproductive tract and the gastrointestinal, the anus, very close proximity, and the potential for contamination and UTIs that are, fecal organisms like our friend E. coli, potentially some Proteus, maybe within there as well. Both of these possible culprits. And in females, a little more easy for something like that to occur. It's also maybe thinking little kids or infants, girls versus boys, definitely more common for it to happen in them. And it's really just an issue of hygiene. As you get a little bit older, you recognize that and hopefully minimize some of those issues. So there are numerous potentials as we move through here and start looking at specific organisms for all sorts of infection. And as we start thinking about this, now instead of really, although some, we could still be thinking UTI, urinary tract, because there is definite connections with this. We also think about STIs, sexually transmitted infections, which is what really the push is, to call it an infection and not a disease, but it's still a disease, all right? So keep that in mind. But apparently calling it an STI has a little less of a stigma than an STD. I think it's the same, but whatever, all right? So there's definitely some potentials as we move through here to see all sorts of possibilities. And with that I know the text mentions in the first bit a handful of different names of some of these based off of really where we may see the infection. So maybe urethritis, as we see urethra, this could be UTI. It also could be an STI. Epididymitis, prostatitis are a couple of potentials where we may see stuff, and there's others listed in there. We are going to skip over that right now, and then we'll get to the details of the organisms here in a second. And there's a lot. So this, like I said, maybe if you've had A&P, you might look at some of this stuff. If I remember right, and this could be two separate labs, but I know one of those labs, there's a lot of water that's being consumed. Some of it is distilled water, some of it is maybe salt water, and then they look at how much urine you're voiding, and then there's also some dipstick stuff, maybe two different labs, I don't recall, but they look at numerous things in there and see, really what's happening. So this, it's not exactly like pH paper, but that's really kind of what I envision when I see these things, as it's the stick is dipped into the solution of urine. You get a couple of different reactions on this stick for different things, and it's testing for various things. And based off of the color change that you see on your stick after it's been dipped in, it kind of codes you out as far as normal or abnormal. Should you be concerned or not? What's actually happening? All right. That's the idea. And if we're thinking infection, this might be one of the first instances that we're able to detect that before we've cultivated stuff. So we've collected the urine specimen, we've done our dipstick, we show that there's some issues, then we start thinking about cultivating and trying to figure out what's really happening in the first place. All right. That's the idea. So this image, these guys, kind of cool, also disturbing. So we got a bunch of them in the first one in A. This is Leptospira interrogans. It's a pathogen. It's something that is released in the urine. We can see this in animals. There's definitely issues with this. It can cause issues in us as a UTI, but we also think about coming in contact with the organism in the environment and setting the stage for issues. I remember years back on regular TV, before it's just Netflix, commercial TV. There were lots of advertisements about Leptospira and being cautious with your pets to make sure that you were being careful with that. And little kid that ends up going blind because he was playing in the litter, or not the litter box, the sandbox at the playground, that the cat or the dog kind of used as a litter box. And in turn, you might recognize the feces and avoid it, but the urine, you don't know, right? And that's definitely an issue. So this spirochete, little corkscrew guy, looks pretty impressive on this. And I believe right here is a filter. You can see the pores in this with that. All right, this next image, this is Uriplasma urolithicum. We've got a couple of arrows pointing at them. So this is an anaerobic organism, so it's grown without oxygen. So maybe, there are multiple incubators that can do this. You looked a little bit at some of this stuff last week, thinking about potentials to grow organisms with lower amounts, like a candle jar, or an anaerobic chamber would be better, or an anaerobic jar, to completely eliminate the oxygen. It doesn't matter. So with this, we're looking at some phase contrast, and there's a bunch, as we see, there's a black arrow pointing, but as you look at that and look all around, this is all just kind of cellular debris. So I feel like lots of times when you start seeing some of these things, and you've never visualized any of this before, if you walked in and didn't have any of these arrows pointing and telling you what's going on, you'd say it's all trash. It looks like it's all debris. I don't see anything that looks like it could be a viable organism. There's all sorts of things. Or maybe you're like, geez, what are all these little things? That must be the bacteria, right? But that's not the case, right? So a bunch of cellular debris. So it could be, epithelial cells, fragments. These are the actual bacteria, and they are odd looking in and of themselves, right? And with urea in both of these, you should recognize that's where it would like to be. And I'm assuming a urease test, like you guys looked at with the biochemicals, these guys would turn it nice and bright pink as well. All right, let me stop sharing that real quick. And go back to this, hopefully. All right, let's see. I think I'm in the actual second bit of this. This, like I said, in this bit of the chapter, this first bit, this is where it goes through and lists off the different potentials, which in turn, we're going to talk about some of these as we're moving through with the specific culprits that cause those issues. And this, well, we'll talk about that here in a second. I was like, what? Non-gonococcal urethritis, how did we skip over all that? We'll get that here in just a second. Okay, the table is what I wanted. So there are numerous things, all right, that set the stage for some potential issues. And again, depends on where we're talking about within the urogenital tract in the first place. So cystitis, there's a handful of different bacterial pathogens that can cause issues. A lot of it we may think of as possible normal flora in the first place, normal flora elsewhere that causes these issues, like E. coli, Enterococcus faecalis, both GI issues. Streptococcus algalactiae is another potential. Klebsiella, staph, Staphylococcus saprophyticus, and there's some others, right? Numerous potentials for these guys to cause issues. So dysuria, pyuria, hematuria, issues with urinating, pus in the urine, blood in the urine. That's really what's happening with all of those. There's pain. It's more common in female than in males. And again, it's more of an opportunistic situation. It's contamination that really sets the stage for this. And the close proximity lends to the more probability with females contracting it as a result. So a handful of different antimicrobial agents treating that. So the dipstick indicates there's some sort of issue happening, and then cultivation, back to that very first image that we showed, can help pinpoint specific microbe. That in turn will signify the respective antimicrobial agent that would be utilized. Leptospirosis, we saw that little spirochete just a second ago. It causes all sorts of issues, fevers and headaches, vomiting, chills, diarrhea. There's the potential, if it disseminates, to cause all sorts of issues. And it may ultimately lend to blindness if you see it not like moving through the body and disseminating, but picked up from the environment and inoculated directly into the eye is the situation for that, how that results. So coming in contact with animal or human urine, but usually it's animal urine that's the situation with that. So more antimicrobials, we can do PCR or antibody testing with that. The non-gonococcal urethritis, the spot where I paused as we were scrolling through this, When we look at this, there's handfuls of organisms that may cause urethritis. And one of them, as this name implies, would be gonorrhea. All right. And it's one of the main players that we think about. But then there's others, and those others we group into this category, the non-gonorrhea. All right. Non-gonococcal urethritis. There's a couple of culprits with this. Chlamydia can be a potential. It's pretty common as far as the falling into this category. It's at the top of our list, not just alphabetical order, but it is one of the common non-gonococcal urethritis culprits. So that's a potential. Mycoplasma genitalium or hominis. Both of these guys are mycoplasmas, lack the cell wall, so they're pleomorphic and very small, definitely compared to the others. And then our uriplasma that we just mentioned a second ago. So as far as these guys go, it kind of depends on the circumstances. It may be mild, may potentially be asymptomatic, which sets the stage to issues because you've got these organisms, but you don't recognize it, all right? So the mild cases, we may see purulent discharge and dysuria as a potential. It is something that's possibly transmitted sexually, or it could be transmitted to the offspring in transit through the birth canal. Sets the stage for that. So pleonephritis and glomerulonephritis. So now we're talking impacting the kidneys. So moving up and causing infection. E. coli, a super good one for UTIs and to have issues more than just within the bladder moving up into the kidneys. So E. coli, Proteus mirabilis, and vulgaris are both potentials for causing issues. Klebsiella, strep pyogenes, and there's a few other bacterial culprits. So as the kidneys are infected, you see back pain, fever, nausea, and vomiting, among other things. There's possibility for blood in the urine, damage to the kidneys, and severe infection can lend to serious complications and potentially even sepsis and death. So it's non-transmissible. It spreads to the kidneys, moving up the urinary tract or through the bloodstream, making its way to the kidneys. In that case, you would already be septic, so other issue, and then infection in the kidneys sets the stage for that. Okay, I think that's it with that. Back, let me stop the share. Where am I in this? Okay. What is happening? Yes, I want to resume. Okay. So shifting over this image also, if you're not thinking about this stuff, you'd be like, there's nothing there. I don't know what I'm looking at, right? So this is a vaginal smear. So as we're looking at this, there should be normal epithelial cells. This would be something, collected pap smear. That's what we're really looking at under the microscope, is trying to evaluate what sorts of cells are we really seeing, all right? So in this smear, we've got a couple pointing right here, normal cells. These would be normal epithelial cells. And then down here, we call these guys clue cells, right? And so it's this guy, but all of the granular stuff you see on it is basically the cell covered with bacteria on the cell. So it's clue cell because it's like kind of like a red flag, and it's like, I think we got something going on, all right? So there are handfuls of potentials with this. I believe Gardnerella vaginalis is one of the main ones we think about with clue cell formation. So we talked non-gonococcal urethritis just a second ago. Now we want to talk about gonorrhea, all right? So there are all sorts of issues, and definitely as we look at these images, both males and females definitely exhibit symptoms. You know something's up, all right? Or you ought to. So here we could see penis with the purulent discharge. There's other issues as we see some of these lesions indicating potentially a co-infection with some other STI, possibly syphilis. That's my guess as I look at that, but there are some other potentials. Homophilus that we'll see here in a second could be another possible culprit for that. Also, maybe herpes. There are some definite similarities with some of the lesions as we see this. Then we have to start thinking about more kind of history, patient symptoms as far as some of that stuff goes. And we can maybe differentiate a little of that before we ever go into more details about cultivating and whatever. It might clue you in one way or the other, all right? Moving over to B, we've got purulent discharge from the cervix and then accumulating in the vagina. Both circumstances, this purulent discharge is oftentimes, maybe a first indication something's up in the first place. And, there's other, as we'll flip over here and see this table, signs and symptoms that you start exhibiting as well. If we were to grow these guys, or not grow, stain them, first look at, I'm like, oh, we're cultivating it up right here, but that's not what we're doing. So here we've stained this stuff up. We've got a lot of white blood cells. These all of these nucleated cells, neutrophils, right within here, and then the little guys, right? Remember, bacteria much smaller than eukaryotic cells, and this is a great example of that. Little teeny speckles right here are the Neisseria. Right next to the gigantic white blood cells that are hoping to deal with this. So we could see some free and some within some of these cells where they've been engulfed and they've been phagocytized, all right? And this isn't the best. I can't remember if there's another image of this or not, but these guys are gram-negative, diplococci. So you can see, as I got my arrow pointing at these guys right here, they kind of say, when you look at these under a gram stain, they kind of have a kidney bean appearance. Two little cocci linked together, gram-negative, so they're reddish pink, kind of like kidney beans, red beans, right? Shifting from that to chlamydia trachomitis. This would be could be the non-gonococcal urethritis. Again, chlamydia, a pretty common culprit. So here we've got an image where we've stained this stuff up. So these are, chlamydia is a bacterium that we classify as an obligate intracellular parasite. What that means is these bacteria have to be inside of cells in order to survive and to replicate. You don't see them surviving outside of cells. I mean, they survive outside long enough to target and get in, but they don't live and replicate outside of cells. They have to be inside of a cell. Kind of like a virus. They're not virus, they're bacteria, all right? But virus has to be in a cell. It's obligate intracellular, all right? So here we can see normal cells that haven't, they look almost like little ghosts, hollow little things, and then these dark guys. So these are inclusion bodies, McCoy cells. So that color indicates the chlamydia within there, all right? There's also potentials for swollen lymph nodes, lymphogranuloma venereum. So swollen nodes in the groin. We often will also just describe this as a bubo. The buboes are the swollen nodes. I think of buboes and I think of bubonic plague. Yersinia pestis is the culprit that causes bubonic plague. And in those circumstances, different, but the lymph nodes would get swollen, very enlarged, infected with all of this bacteria and would become necrotic. And so you get all of these black swollen buboes, and that's why they call it the Black Death, all right, from all of the necrotic buboes. Crazy, all right? This, not the same idea, different buboes, all right? But similar situation where the lymph nodes infected, you've got massive amounts of organisms, swelling, inflammation, that's pretty apparent. Chlamydia, just as we're on this slide, little tidbit of information. It is a very common STI, and on this campus, it's definitely pretty prevalent, right? I can't tell you with, with the plague that we are in right now, I would hope maybe that's minimized a little bit, all right? But definitely there are issues. And this was years back, probably a biology class. Student health was in, just to mention all sorts of things that student health can do, testing, different things. And then she mentioned some details about STIs and chlamydia being really pretty common. And again, this was a couple of years back. Statistic-wise, I assume it's probably pretty similar. But as she was mentioning, and this is people going to student health, they speculate about 10% of the student population infected with chlamydia. That's concerning, all right? As you think, what, maybe 10, 12,000, 1,000 or 1,200 students potentially, that's an issue, right? It kind of, I hope, makes you stop and think for a second, right? And with that, there are numerous things where you don't recognize there's issues, all right? So deep down, I feel like you ought to probably just assume, all right? And then maybe you'll be a little bit safer. So shifting over, this next one we want to look at is syphilis. Treponema pallidum is the bacterium that causes syphilis. It's a spirochete, kind of like that leptospiro that we looked at before, corkscrew looking guy, all right? So there's multiple things happening with syphilis, and we can see 3 different stages of the infection, potentially 3 stages. If there's no treatment, we may ultimately wind up progressing to this last stage. So initially with syphilis, you see an ulcerated sore, a hard chancre that's caused by syphilis. And as we were looking at that gonorrhea before, it said, potentially other stuff. Maybe there's something like that as well, right? The next image, B, is a secondary syphilis rash on the hands. And this ultimately transmitted coming in contact sets the stage for that. There's also the potential for dissemination, but I believe this is, that's how that's occurring in the first place. After a considerable amount of time, you can see tertiary syphilis potentially resulting, right? And maybe no recognition of any lesions at this point, primary or secondary, all right? The tertiary syphilis causes bone and tissue damage. Not that it doesn't look like we've got tissue damage in the first place, but this is different and it occurs elsewhere. Here we can see on the nose, but like I said, it can cause destruction of the bones. It can cause neurological impacts and cause some serious issues with that. And again, oftentimes with this treatment prevents the progression to this tertiary stage in the first place. So here's an image of syphilis, trypanema. So again, little corkscrew spirochete. This is dark field microscopy. And then we've got these guys over here with some silver stain that allows the spirochetes to be visualized. And I'm assuming this yellowish stuff, cellular debris, likely epithelial cells that we're seeing within there as well. That's my guess. So similar name, but not the same. This chancre, this is a disease that we call chancroid, and it's caused by a type of bacterium called Haemophilus, Haemophilus ducreyi. And trying to now that I started thinking this, I'm like, wait a minute, I want to tell you the right thing. There are differences. They look different as we look at the chancre here versus here. And if I recall properly, syphilis is painless and Haemophilus is very painful. All right. The text probably mentions that stuff. I don't recall right off the top of my head. It's one or the other. All right, one of them is painless and the other painful. I think I've got it right because with ducreyi, it seems like I remember decry. You're gonna cry because that sucker hurts. That's how I remembered it. All right, but it's really ducreyi. So these guys, we could see the Haemophilus over here, gram-negative, pretty big filamentous rods as we see them. All right, here in this stained smear. Haemophilus likes to grow on, like chocolate agar or something like that. Here we see it cultured with some rabbit blood, but I'm assuming it's probably been cooked, so it's lysed those cells. Let me flip back to the text. Okay. So with this, a few, the bacterial vaginosis, the Gardnerella vaginalis, those were those clue cells that we looked at a second ago. Bacteroides, Fusobacterium, there's a few potentials that can all cause these issues. In some circumstances, we will figure out exactly what we're dealing with. Otherwise, maybe the treatment, it's similar. So it may not require actual identification through cultivating. Just finding organism growth on the plate might be sufficient. Oftentimes with vaginosis, it can be asymptomatic, so you may not recognize there's issues. Low levels maybe of bacteria growing and having some imbalance can set the stage for what was asymptomatic to now become symptomatic. Kind of sets the stage for variation and really just kind of depends on the circumstances. So if it's not asymptomatic, you might see some vaginal discharge. There could be burning and odor and or itching, probably all of the above. It is opportunistic. And so typically we think of some sort of imbalance in the normal flora. So like I said, you've likely already got some of these players, and then having some alteration, a shift in the pH might be sufficient to lend to some of these that were maybe held in check to now potentially thrive. That's a potential. There are some possibilities with this, with variation in hormones and potential hormonal imbalance can set the stage for something like this. There's possibilities with variation in the menstrual cycle, where you can see estrogen levels fluctuating. And as the estrogen, if I remember right, as it starts to decline, that sets the stage for an alteration in pH, making it more basic, lending to these guys, right? So that's a possibility. As you start approaching menopause, you see estrogen levels starting to decline. Again, issues for alteration in pH, alteration in chemistries that lends to some of this variation, right? So it really kind of just depends on the circumstances, and really depends maybe on the woman and what's happening in the first place. Okay, here, yep, I knew it. Here's the painful one. All right, so chancroid, homophilus, soft, painful chancres on the genitals typically, but they can't, dependent upon what's going on. You might see them on your mouth, could be on the anus. You can also exhibit swollen lymph nodes and discharge. So sexual contact or contact with the open lesions are potentials for contracting that. And with this negative tests for syphilis and herpes, clues us in that that's what we're dealing with here, because you're thinking potentially other stuff going on initially before homophilus is on the radar. Chlamydia, chlamydia trachomatis, often asymptomatic in men, often asymptomatic, really maybe in both, but in men, we can see if you do exhibit symptoms, urethritis, epididymitis, orchitis, maybe a little bit of pain at urination, maybe a little burning at urination. That's not normal. So if you are exhibiting issues like that, you probably ought to go see a doctor, right? Oftentimes, men don't typically want to do that, especially if you're talking about something going on downstairs, right? Burning when I pee, that's fine, right? It's all good, right? It's not fine, right? So in women, definitely you're going to see some more pronounced symptoms. There are possibilities for it to be asymptomatic in females as well, but it's definitely more common to see that in men, all right? So in women, urethritis, vaginal discharge or bleeding, there's the potential for pelvic inflammatory disease, the non-gonococcal urethritis, sapropharyngitis, and there is an increased risk, and this would, my gut tells me something that's maybe a little more asymptomatic. You go, progress undetected for a considerable amount of time, sets the stage to increase the risk of cancers, cervical cancers. So we do think sexual contact, but there is the potential for the mother to pass it to the child as they're hatching out into this world. All right, gonorrhea, Neisseria gonorrhoeae. With this, there's all sorts of potentials. We saw some images, urethritis, dysuria, penile or vaginal discharge. There's potential for rectal pain and bleeding. Females, pelvic pain, intramenstrual bleeding. So something that should be a flag. It's not the right time for your menstrual cycle to be commencing, midway through the cycle. All of a sudden, you think you're starting to have your period. That should be a flag. Something's up, all right? Sapropharyngitis, increased risk of infertility as the bacteria can progress up, maybe into the fallopian tubes, causing some serious inflammation. Blockages possibly lending to ectopic pregnancy, where the egg isn't able to make its way down to the fallopian tube or through the fallopian tube into the uterus. And so it tries to start growing really within the tube. So there's possibility for disseminated infections, other issues for sure. And this would be, as it's progressed untreated. So this sexual contact, there's definitely, issues with this where there are possibilities with, the mother passing it to a child in transit. We saw the baby with the eyes that were all infected in the whatever chapter, skin infection, skin and eye infection. We mentioned a little of that, but deep down, we really think sexual contact is what's doing that. And syphilis, Treponema pallidum. Like I said, multiple stages. The primary stage, the first initial stage, is a hard chancre back up to the top. The chancroid with Haemophilus is soft and painful, and syphilis hard and painless. It doesn't say that, but it's not painful. All right. But any sort of lesion should be an indication you got something going on. Secondary stage, we can see rash starting to result, cutaneous lesions. You saw the hands, the condylomata, malaise, fever, lymph nodes that are swollen, progressing to the last stage, the tertiary. You can see these gumas, which were those skin lesions or bone lesions. There's all sorts of other serious ill effects, cardiovascular and neurosyphilis, all setting the stage to possible fatal consequences with that. So again, sexual contact or transit through the birth canal, and some microscopy, some immunodiagnostics, looking at antibody to detect with that. And that's it with that. Okay, and I think that, looking at my watch, that's the end of this. Any questions or concerns at this point? Okay, guys, have a good day.